Well, doctors typically see RSV in November and December around the holidays. Last year, they didn't see much because of COVID-19 precautions. But this year, they're seeing a spike earlier in the year. And it's not just among infants, but among 1 to 2-year-olds as well. As hospitals battle COVID-19, some have their hands full with another contagious virus. Connecticut Children's is seeing an uptick in cases of respiratory syncytial virus, also known as RSV, something mother of 2 young kids, Marianne Greenwood from Preston, has learned a lot about recently, firsthand.
My 5-month-old little boy started coughing. And then it turned into he was wheezing. They did a nasal swab, and he tested positive. And so they said to just keep an eye on him.
But shortly after, her son's symptoms started to get worse, so the family took him to the ER at Connecticut Children's in Hartford.
He got put on some oxygen. They did some nasal suction. They gave him some albuterol. They tried to take him off of oxygen, and his O2 levels dropped again. So they put him back on, and then they admitted us for the evening for that night. So we ended up spending the night at the hospital.
Greenwood says the coughing lasted for another week or 2 after that. Her 2-year-old also ended up contracting the virus, but it wasn't severe.
It's really stressful that it's just kind of a wait and see. There's not really much you can do for it.
Greenwood is not alone. Connecticut Children's pediatric critical care physician, Dr. Chris Carroll, says they have seen an increase over the last few months, and the spike is coming earlier in the year.
We admit about 350 to 400 children every year to the hospital with RSV. This year, we're seeing probably close to twice that.
Here's what signs and symptoms parents should look out for.
Fast breathing, noisy breathing, both when they're breathing in and breathing out. Prolonged exhalation, so if it's taking them a very long time to exhale. And the children that we really worried about are children who are not eating anymore, who are not having wet diapers anymore, and children who are sleeping a lot and very lethargic or are very irritable and won't stop crying.
Dr. Carroll says it's rare for a child to die from RSV. The virus typically lasts 7 to 10 days. Live in Hartford, Alicia Machado, Fox 61 News.